Hospital infection control policies and program. Introduction. Healthcare associated infection is one of the most common complications of healthcare management. It is a serious health hazard as of now. It increases patients' morbidity, the disease rate among the patients. It increases patients' mortality. If it is not treated on time, it may lead to death. Length of patient stay is increased because what was the condition they came and got admitted in the hospital is no longer the same condition what they have been treated for. So length of the stay will be increased. Increased patient cost of hospital stay. If the length of the stay increases, cost of hospital stay also increases. Then infection control and prevention provides high quality healthcare for the patients and safe working environment for healthcare staff. This course outlines the broad principles and practices of infection control that are essential for prevention and management of infection in the hospital. So learning this course, you will know what are the guidelines, policies, and principles you have to follow when it comes to prevention and management of infections within the hospital. So these are the guidelines for prevention of control and infection. Different types of hospital acquired infection, you will have different guidelines, policies to prevent it. So those guidelines will be listed down and you have to learn about that. Antimicrobial policies, antimicrobial stewardship, what are the oaths the stewards has to take, what are the key areas the antimicrobial stewards have to take, where antibiotic stewards have to bear in mind, that will be taught. Surveillance policies, each of the healthcare facility infection should be recorded and analyzed, and after analyzed, investigation and control should be done in the surveillance area. uh, then infection control policy, disinfection, that will include sterilization, decontamination, different levels of cleanings, fumigation and fogging required. Those are the policies will be covered in this disinfection area. Isolation policy, if at all the hospital has an isolation room, what are the key areas the visitors, patients, and the staff have to keep in mind within the isolation room, that will be enlisted. Policy for investigation and outbreak of infection, if at all there is an outbreak of infection within the hospital, investigation steps are taken down to control the outbreak and also to prevent it in the future. So hospital infection control committee annual infection control program should be updated. At least one review annually has to be done, and new updates should be added into your infection control program and policy. Maintaining a surveillance over healthcare associated infection. Every health high risk areas within the hospital will have the record of different types of hospital or healthcare associated infection, and which will help in the surveillance. So when it comes to the hospital acquired infections, you have to identify what are the diseases which will come as hospital acquired infection. You have to report it to the infection control officer, analyze and investigate it because of the failure of which aspects or which methods this the patient acquired and hospital acquired infection, and then you have to take steps to control it and to control the damages done. So develop and implement preventive and corrective programs for infection hazards. For CAPA, corrective action and prevention action has to be put into place for all the infection hazards. Advise the management on antibiotic policies, and review and update the hospital infection control policies and procedures from time to time. Health education for the employees should also be given. Staff training has to be done. Now this is the infection control committee. Chairperson, also the head of the institute can become the chairperson. When it comes to the member secretary, senior most microbiologists can become the member secretary. Representative members of different management and administration area like the HR, accounting, nursing services, and top management, hospital managers, etc. Relevant medical faculties. What are the medical faculties are there within the particular hospital? For example, gynec department, ortho department, surgical department, medical department, everything can come under medical faculties. So representations from each of these medical faculties can come into the infection control committee. Infection control officer, then infection control nurses, support services from OT, CSST, housekeeping, maintenance staff, pharmacy, etc. So they form the infection control committee. When it comes to infection control team, there are three key players in the infection control team. One is the microbiologist, one is the infection control officer, and infection control nurse. Education and training of staff by the infection control team. So assess the training needs. You have to assess first of all what is the knowledge that and information your staff already have, and you have to see what information you require. Whatever is the gap is there between the present knowledge and the knowledge which you want to impart, that gap has to be filled by providing training, awareness program, in service education, and on job training. Next, organize regular training and programs as per job description of the staff. So the regular training programs which you give to the senior most staffs and to the ANMs are different. The training programs which you give to the pharmacist is different from what you give to the doctors. So regular training programs according to the job description should be conducted. Periodic retraining should and orientation should be done so that the staff won't forget what was taught to them. Review the impact of training. After providing training, you have to give self-assessment test to the staff, or you have to observe the staff during the duty time if they are imparting the knowledge which they have gained from this training, they are putting it into actions or not. So that is the review. Next is surveillance of healthcare associated infections. It is defined as systematic collection, analysis, interpretation, and dissemination of data about the occurrence of healthcare associated infection in the definite patient population. You have to collect it, you have to record it down. What are the healthcare associated infection and who got it? You have to do the analysis because of the failure of what activities this particular patient got the healthcare associated infection. Interpretation has to be done. This has to be communicated to the staff. Dissemination of the data, what all data you have collected, converted into a tangible information, and this has to be sent to the infection control committee among the staffs and the team members. Then objectives of surveillance related to healthcare associated infection. Continuous monitoring of incidents of infection rate. You can't skip any day or two. Every day you have to do a continuous monitoring of any new hospital acquired infection cases from the high risk areas. Continuous monitoring of trends and detection of hospital outbreaks, if any. You have to see which month you are getting the highest hospital acquired infection, or from which department you are getting the highest hospital acquired infection. Then provide early warning and investigation for infection problem so that you treat it early, you are not late. Planning and intervention of control should be done among the staff handling the cases. Prioritize the resource allocation. When as a hospital administrator, you have to prioritize which are the number of items you should be sending to the high risk area and which should be sent to the low risk area. Always high risk area should be given a special consideration when you are doing resource allocation. Examining the impact of intervention. Whatever steps you have took to control the outbreak or any infection, you have to see those steps are working or not. Gaining information on the overall quality of patient care. So components of surveillance system. Then you have case definition. So every case in a surveillance system has a particular definition. For example, when it comes to hospital acquired infection, any case that has come into the hospital that after 48 hours of admission, the patient is showing new symptoms, and that infection and that symptoms was not present when the patient was there in the hospital before 48 hours. So that becomes a hospital acquired infection. So it means that there's a proper case definition for each and every diseases or infection. So you should not deviate from that definition. Anything outside those definition will not consider as an hospital infection, acquired infection. Okay, so active surveillance of healthcare associated infection should be done from in the high risk areas like such as intensive care units, surgery areas, and operation theaters, dialysis unit, burns unit, transmission services unit, food handlers, drinking water, CSST. Okay, these are the areas where active surveillance of healthcare associated infection should be done. In OTs, no routine fogging is recommended, and if at all there is any engineering work or refurbishing done prior beforehand, only you have to take the permission for that. And cultural swabs and air sampling are sent from the operation theaters on a regular basis to check if there are any chances of any outbreak from the OTs. Also, you have to follow the same steps in the ICU also. And ICU special case care for catheter associated urinary tract infection, ventilator associated pneumonia, okay, and the central line associated bloodstream infection. So for these cases, special eye is kept out for in the ICUs. So these are the components of surveillance system.